Hi everyone, Dr.Jyotsna here. I will be talking about tailoring of alarm on mechanical ventilator. I will be talking about its importance, how to do, and what are the exam. I will give you some example which will tell you how important it is in some condition to tailor the ventilator alarm according to the patient condition. It might not be required for every patient, but it may require for any patient. So what happens normally in default setting on ventilator, 10 to 15% of the default minute ventilation, default tidal volume, default respiratory rate, default peak inspiratory pressure, 10 to 15% low and high of that is taken as a alarm limit. If it is low or if it is high, 10 to 15% of the default limit of these values, the alarm will ring and the alarm will show that okay, low minute ventilation or low tidal volume or high minute ventilation, high peak inspiratory pressure, it will audible and visual alarm will be there. And there are some new ventilator in which they will take the initial few breaths of the patient, and accordingly what they will do, what they will take it as the baseline value, and the 10 to 15% lower and upper value they will take as an alarm limit. So this will happen normally. But when uh, but when there are certain condition, like in case of bronchial asthma, I will just give you example. There was a patient of COPD, and the patient was intubated because of the severe bronchospasm. There was no air entry, and even after an ablation and all, we were not able to. Their chest was silent, and peak inspiratory pressure alarm was going on. Low minute ventilation alarm was going on. Low tidal volume alarm was going on. So patient was reintubated, thinking of there might be tube block. But then also it was reconfirmed by several methods that the ET tube is in place. EtCO2 graph was checked, which showed that severe bronchospasm, which is known as sharp finger appearance, EtCO2 level was 58 in that patient. And then USG chest was done. They saw that there was a normal, it was normal. Chest x-ray or hyperinflation was there, but bilateral lungs marking was there, but there was no pneumothorax. So all these problems has been ruled out, but only thing was there was a bronchospasm. According to, even the ventilator was changed, the doctor has changed 3 ventilator. Then he thought that okay, I think there is some problem in the ventilator setting. So then he asked his senior doctor. Then this Mr. Magician, the senior doctor, comes, and he simply, what he does, he simply increase this peak inspiratory pressure further, increase it to 60, and then the ventilator start giving proper tidal volume. So what was happening, whenever 40 was set, so whenever it was going 40, the peak inspiratory pressure was going 40 because of the bronchospasm, severe bronchospasm in COPD. So till this condition get reversed, we need to increase this value. Otherwise, whenever this value was reaching, the expiratory valve was getting open by itself, and the volume without going tidal volume, that volume was just coming out, the flow was coming out. So this was happening. So these are the condition, one of the condition, very important condition, I will tell you, that which requires ventilator setting. There can be many other conditions. Another two example I will give you. We in ARDS patient, and in many patient nowadays, we do low lungs protective ventilation, especially for ARDS patient. We may have to go even 5 liter per minute, liter per kg. Sorry, it's not minute, it's kg. 5 liter per kg. So what happens that in such condition, it may show that low volume, low minute ventilation alarm. So we have to set it according to our patient requirement. In the same way, if the patient is having air trapping, dynamic hyperinflation, COPD, and patient may require we have to disconnect the patient and let the exhalation itself, the trap air come out, and then we again we have to put him on ventilator with low minute ventilation, low respiratory rate, low tidal volume. So again the alarm can ring. So we have to set alarm according to the patient condition. Thank you.